Welcome to Everyday Therapy, where simple and practical concepts of therapy meet your everyday life. Hosted by licensed marriage and family therapists Brett Cushing and Krista Overson, we're here to help you unlock tools and strategies you need to become the best version of yourself. Whether you're looking for guidance, inspiration, anecdotes, or actionable advice, you're in the right place. Let's dive into Everyday Therapy.
Today we're going to be talking about depression. Very common, one of the most common reasons why people come to therapy, and very relevant, especially this time of year, because we don't have as much sunlight, and the holidays can cause depression too. So many of us are probably familiar with this, and it's really actually estimated that 3.8% of the population experience depression, including 5% of adults. That really breaks down to about 4% of men, 6% among women, and about almost 6% of adults older than 60 years old. So approximately 280 million people in the world have depression. And so what is it? I mean, you have people who have depressive symptoms and they're feeling genuinely depressed. Does that mean they have depression? How do I know where I am? How do I get out of it? These are all things we're going to try and talk about today.
Yes, this is such a great topic, lots to unpack. I think the first thing that we can say is that there's a lot of different kinds of depression. There is the way that we kind of determine whether someone is experiencing, it's called a major depressive episode. And so major depressive disorder is one of the most commonly diagnosed conditions. Now, there's a set of symptoms that people can look at, can go through to determine, in the last 2 weeks, how often have I experienced any of these depression symptoms? If you're looking for a kind of a questionnaire, we do have one at niceturn.counseling.com. It's called the PHQ-9. It's very commonly used in our world. And so you can go and complete that for free if you're interested. But that's one of the big tools that we use to find out, is this just having, a rough time? I'm stressed out. Some things happen to me where I'm really, sad. This is more areas of functioning, I would say, than just kind of having a tough day.
About 10 questions.
Yep.
Super simple. And a lot of times if you go in your doctor's office, they'll give you this as well to fill out, and you can get it on our website.
Right. So major depressive disorder is just one type of depression. And like we said, it comes in episodes. You can recover from it. It's not forever. Now, another one is bipolar disorder. So bipolar disorder has both depression elements and manic elements. Mania is kind of the opposite of depression in that it's a time of very high energy, not needing much sleep. You might have euphoria. You might feel very motivated, almost like, the opposite of how you feel when depressed.
Yeah, just the opposite. And really marked a lot by impulsivity.
Yes.
Especially in relation to spending.
Yes.
But other kind of...
other behaviors too. Reckless behaviors can happen.
Reckless, risky behaviors because of the impulsivity.
Exactly. Yeah. So when we're assessing someone for depression, we're also asking about mania, because with mania, there might be sort of a bipolar depression happening where it's quite different from a major depressive episode.
And typically what happens is that people will be in that manic phase for a period of time, or that depressive phase, like there's type 2, like 3 days to under a week about, and then there's type 1, which is beyond that for like a month, can be up to 3 months.
Yeah, exactly.
Good to know. Like, some people say, well, I feel great, and it's like after a football game or something. Right. But this is a little bit more sustained than that.
Exactly. Then you had mentioned something earlier, Brett, which was the time of year. So there's also seasonal affective disorder, which is a type of depression like disorder that has to do with the lack of sunlight that we experience, the cold weather. I think that does affect our mood. So some people only experience depression around this time of year, and the rest of the year they're pretty good.
Yeah, take the vitamin D, right? Pack in that.
Yes.
There's another one called persistent depressive disorder.
Yes. So how would you explain that one?
So that one is interesting because it's maybe not as intense as major depressive disorders, but the duration is quite longer. This is sort of a malaise, if you will, throughout your life. You know, this is going on, like you said, major depressive disorders can be limited in time, but
Right.
Persistent depressive disorder is going to be kind of just what it says, persistent throughout your life.
Yes.
Oftentimes it's not accompanied by suicidal thoughts.
Right.
Whereas major depressive oftentimes can be.
Yes, that's such a great point. I like to think about persistent depressive disorder as like a low grade depression that's kind of always there, right? Yeah. Whereas a depressive episode can be markedly different from your from your everyday usual functioning, where it's like, wow, I'm really being affected by this in all these areas of my life. Whereas persistent depressive disorder, you can kind of get through, but you're just kind of always down, right?
Right, yeah.
Right.
Very understandable.
Yeah. And then I guess we'll just touch on a couple of other ones. So perinatal depression, that has to do with postpartum, right?
Yeah.
And that can have to do with a lot of different factors. We do have a mother-baby program here at Nystrom, which is fantastic. All of that information is also on our website. But lots going on hormonally for women after they give birth and then are raising a child. Another hormonal, I would say, related for women is premenstrual depressive disorder. So some women, when their hormones are shifting prior to having a menstrual period, they might notice that their mood takes a dive. And that can be very debilitating as well. So as you can see, there are lots of different types of depression, and it can get a little bit complicated.
Yeah, and I think we need to, it's helpful to know these terms, but also to know what your body's telling you.
Yes.
When you're experiencing some depression. And could you touch on that briefly? Like, how do I know? Because I think of our body as kind of like a dashboard on a car. And it kind of tells you how you're doing.
Yeah, that's so true.
And physiologically, our body gives us kind of messages of things to pay attention to know if we're having symptoms consistent with depression. Can you think of any?
Absolutely. I think a big one to always look at is sleep. I think our sleep gets affected by depression. Some people might find that they are sleeping way more than usual. That's a really common thing that I hear. It's hard to get up out of bed. All I want to do is nap. All I want to do is sleep. Or the opposite, where they were sleeping okay, and now it's not that they don't need sleep, but they're just maybe like, I'm having a hard time falling asleep. I'm having a hard time staying asleep. So with a mood disorder, which is what depression is, sleep gets impacted. Another thing that comes to mind is appetite. Some people, and I think this kind of goes along with a lack of, sometimes with depression, you have a lack of interest and a lack of, kind of pleasure. So with that comes, I am finding that food doesn't have the same pleasure for me. So I'm not having an appetite as much. I'm not eating things. Or again, the opposite, where it's like, man, I can't stop eating. Because again, I think it's your body's attempt to like sort of solve the problem. Like maybe if we take in more food or more sugar or more feel-good chemicals, maybe this will lift.
Right. Yeah. It's we just lose that sense of pleasure. I think we have other things that we notice. I just can't concentrate as much. Maybe I'm a little bit more irritable.
Yes.
I'm walking around with this excessive sense of guilt and worthlessness. Those are all really key signs. Obviously, depression, either having a plan, or sometimes people don't realize just this idea that, wow, who would really miss me if I wasn't here? And that, a lot of people don't realize that's suicidal thoughts too. And 70% of people who have those passive suicidal thoughts actually end up hospitalized eventually. So we do want to recognize that.
I'm so glad you pointed that out, especially the difference between a passive and an active suicidal thought. So I would say for those listening, a big takeaway of, you had asked, how do I know if I'm depressed, right? I would say when you start to have thoughts like, I'm a burden on my family, I'm a burden on my relationships, maybe I'd be better off, maybe they'd be better off if I wasn't here. Now that's more of a passive suicidal ideation, because you're not thinking to yourself, I'm going to do this active thing about it, right? But even so, I think what you're saying is please pay attention to those thoughts, right? Yes, because that's a red flag, I think, for depression.
And in all of this, hard as it can be when we're depressed, try not to be critical of yourself for having these symptoms. Try to be more curious about it. Like, oh, wow, I wonder what this means. Like, I don't get critical if my dashboard of my car says something. I get curious, like, oh, I wonder, I probably got to get this looked at.
Exactly. I think that's I think that's a good overview of some different things to pay attention to. And again, if you find yourself wanting to talk with someone, talk with a therapist, a counselor, they can definitely help you determine, is this normal? Am I stressed and run down, or am I actually having a depressive episode? So what would be some lifestyle habits to reduce the risk of depression? I know there's findings from a major study that there are 7 habits that reduce depression risk of becoming depressed by about 57%, regardless of any genetic predisposition. So yeah, do you want to kick us off on some of those healthy habits?
Sure. I think drugs are things we go to because they work and they make us feel good, and we have to be careful, obviously, with any illicit drugs, illegal drugs, but we also have other drugs like alcohol. So moderate consumption of alcohol. But I think there's other drugs that we need to consider, such as sugar and caffeine, that we want to have moderate consumption of those things. I would say even closely related, like with our diet, sort of having a kind of a balanced diet, like not real heavy food, not real greasy, fatty food.
Fast food, maybe. Yeah.
Fast food, maybe. Right. Also, physical activity. Some people have said this is kind of the natural antidepressant, anti-anxiety thing you can do. It's super effective. So about 150 minutes moderately or 75 minutes vigorously per week. And then we want to move. I always tell my clients, I never say, hey, cheer up. Come on, get your act together. Be happy. I just say, hey, if you're going to be depressed, and just move. And keep moving. It's sort of like Dory from Finding Nemo when she's singing, just keep
swimming, just keep swimming.
Yeah, just keep moving.
Yes.
Smoking, try to get rid of that as much as you can. Sleep, you had mentioned probably 7 to 9 hours is what we're shooting for. And in addition to just keep moving, get connected. The urge is so strong to isolate and be by yourself. So we really fight that urge.
I always tell my clients too, I try to validate, depression can be such a bugger because it seems to steal your motivation. So you, of course, just want to sit on the couch or sleep in bed, right? It steals your pleasure.
Yes.
So then it's like, well, the things I used to enjoy, I'm not really enjoying anymore. So one of those might be socializing, right? And then I'm not feeling like exercising. So I think what you just said is really powerful about whatever you do, keep talking to people.
Yes.
Keep moving. Because again, everything depression wants you to do is stop, slow down, isolate. Yeah. And what we need to be doing is the exact opposite of that.
And one other quick thing I want to add is to keep moving. Don't think, I got to get up and get ready today.
Sure.
Do it sort of one thing in the moment. I'm going to get out of bed.
Yep.
I'm going to walk to the bathroom.
Yep.
I'm going to brush my teeth.
Yes.
And when we think about it, when we're depressed and we think about one big thing I have to do, it's sort of paralysis by analysis. So just take little bite-sized things and keep moving.
That's actually a really good segue into some other strategies for managing depression in the moment. Because you just touched on, the instinct with depression is to slow down, to stop. You're talking about breaking things down into one by one in the moment activities. So I think an important thing for people to do is, even though you don't feel like engaging in your previously enjoyed activities, do them anyway. I think it's okay to do things, but don't wait to be motivated. Because if you're feeling depressed in the moment, you could be waiting a long time. And I think that's a trap that is easy to fall into.
Well said.
Yes.
So I think, what do we do with that is not, like you're saying, don't wait for the motivation. Try to have a plan maybe of, all right, I'm going to plan out my day. And you might have to do it in more bite-sized chunks, like every 30 minutes, every hour, and I'm going to go work out. I'm going to go talk to this person.
Yep.
And so be intentional with what you're going to do and write it down almost like it's
scheduled
like an appointment.
Yes.
You're not going to miss an appointment.
Yes.
And so you're making appointments with yourself throughout the day.
So that they're already in there and you don't have to wait to be motivated, right?
Right.
I have a dear friend who has periodic depressive episodes, and she will reach out to me and make plans for the weekend, and she'll let me know, like, I'm kind of struggling, but it's like, okay, we have a plan, we're going to get together this weekend, right? And it's like she just knows to do that because it's it's tough to do it when you're already feeling depressed.
Yes.
So I think if she can feel something sort of coming on, that's one of the ways that she prevents this.
I'm glad you brought that up, because I was just talking to one of our DBT patients about going out and not isolating. And the person said, if I go out, sometimes it's a negative environment for me, and I also don't want to be around that. And I said, well, let's take a middle path.
Nice.
Rather than I have to go out or I'm going to stay home, why not go out, see how it is?
Yep.
Try to set a boundary for yourself. Like, hey, guys, I just can't talk about this tonight. Can we pivot? And if people can't, you can still go home. Now, what I like about that is notice how empowering that is for you taking control of your life.
Yes.
And that's key in trying to deal with depression, too.
Exactly. And know your safe, trusted people. So again, when my friend reaches out, we have an understanding that we can tell each other if one of us is struggling. And so it's like, she doesn't even have to explain it, right? It's like, we just kind of know, we kind of have, our shared understanding of things. And so, yeah, figure out your safe people in advance. And it may only be one or two people.
Well, how do you know if people are safe? I think, you have safety there because you respect each other's boundaries.
Right.
I just can't go there. And sometimes when we're dealing with depression, other people, I think of that line from A Few Good Men, like, you can't handle the truth.
Yeah.
And some people just can't handle our depression.
Because they
want to fix us.
I was just going to say that, because you asked, how do I know when someone's safe? And I would say that's one of the main things, is not knowing when someone's not going to try to give you advice, cheer you up, fix you. They're just comfortable being with it. Right?
They can say things like, oh, I hate this for you. I'm
Sure.
so sorry.
Yes.
Is there anything you need?
Exactly. But it's not going to be like, oh, come on, look at the bright side. Right?
They're not going to should on you to be better.
Exactly. I think another really important tool is self-compassion. And self-compassion is treating yourself with the same kindness and care that you would offer a close friend. So I'd want to touch on 3 components of this. The first one is replacing self-criticism with understanding. So just notice how you're talking to yourself. Try to be kind to yourself. Another is recognizing that everybody struggles. So acknowledging that you are a human being, and that you have a shared experience with all of humanity. And then finally, acknowledging your emotions without over-identifying or without judgment. Because along with depression comes all sorts of different thoughts and feelings. And if you're in a place where you're judging and criticizing them, that can be very, very difficult to manage. And that can really spiral. So I would say a practical tip for this would be to come up with some self-affirmations, statements like, it's okay that I'm struggling, I'm doing my best. And any other ones that you can think of.
Well, and I think people struggle ever since, and it was a hilarious skit on Saturday Night Live. Was it Stuart Smalley? I'm good enough.
And gosh darn it, people like me.
And so maybe if you struggle with that, it's not even self-affirmations, but it can be just principles that I want to live under. And I'd like, hey, I'm doing the best I can. Everybody's doing the best I can. That includes me.
Exactly.
And I can still do better.
Exactly.
But it's more balanced. A lot of times it's very much all or nothing when we're depressed. I'm terrible. I'm awful. Nothing's ever going to get better. And I am doing the best I can, and things are going to get better. And so I think that plus self-care. Is the thing when we do self-care, getting enough sleep and exercise and eating and everything we talked about, you'll know you're doing it right if you're feeling like you're being selfish. That's the tragedy for a lot of us. When we start self-care, we believe we're being selfish. And just keep doing it, because that's not selfish at all. That's what's needed.
Exactly. I think that's a really important point. And feel free to journal, write a letter to yourself. You could write a letter to a younger version of yourself.
Ooh, I like that.
Right?
Yeah.
Or write a letter to yourself as if you were supporting a friend. And that kind of can help take yourself out of it if you're really struggling with self-criticism.
Right.
So, yeah. I mean...
So when we think about therapies and people are saying, okay, I have one of these forms of depression, what can I do for therapy? And we'll throw out all sorts of terms that have all sorts of initials behind it. One is CBT, and that is cognitive behavioral therapy. Fascinating. I love it. It really highlights that much of how I'm feeling is based upon how I'm thinking and how I'm perceiving the world, what I'm believing about the world and about myself. And so it really brings to the surface what we're thinking and how that affects our emotions. And it's proven really to lower relapse rates and enhance medication effectiveness. So it really couples nicely with medication.
I think, let's go over just really quick cognitive behavioral therapy, the title one more time, because I get caught up in the initials and I'm like, oh, wait, what are the letters? So cognitive obviously would be dealing with our thoughts, like you said.
Yes.
Behavioral, so cognitive behavioral, the other piece it really focuses on is behaving in ways that you know are going to produce a different thought or feeling. So knowing that how I am choosing to act or not act is going to either positively or negatively impact how I'm thinking and feeling. There's a triangle. So if you think about thoughts, feelings, and behaviors, all 3 points of a triangle, I would say that's the big hallmark of this one.
Yes, it all plays off of one another. Can I touch on dialectical behavioral
Please.
therapy? Because that's one of my wheelhouses.
Yes.
So also known as DBT, dialectical behavioral therapy. We did months on this, I think starting about January of 2024.
Yes.
And so you can learn all about DBT. Highly effective intervention, very helpful and successful in treating chronic depression. And it borrows a lot from cognitive behavioral therapy, but also adds in a lot of skills, mindfulness activities, and a lot of people think it's just skills, but having a different way of looking at the world and trying to get out of the all or nothing way of viewing yourself, viewing the world, etc. So a lot that could be said there, but I think for time's sake, we'll suffice that that's what DBT is.
Yes, exactly. I think that another one that I know I use quite a bit in therapy is psychodynamic therapy, which is a little tricky to explain, but the idea is, I think if I had to summarize, would be we take on a lot of beliefs about ourselves, about relationships, about the world from our early years of development. And we're kind of looking back into the past, not to blame our childhood or blame our parents or anything, but we're looking back into the past to see, okay, what did I learn that this, that, or the other thing means? And how am I still continuing to play that out as an adult? So there might be things that are not an effective way of seeing things, but I'm still seeing things that way. So it's a chance to correct some of those things.
Right. Yeah. So last one that we've been doing more and more of here at Nystrom & Associates is TMS, also known as transcranial magnetic stimulation. And this is really understood to be a very non-invasive procedure because it's done without using surgery or anything like that, but it's focusing on the brain, and it's a procedure that uses magnetic fields to stimulate nerve cells in the brain to improve symptoms of major depression. And so there's a lot more that can be said about that. But if you're looking, you could refer to it as TMS if you can't remember, transcranial magnetic stimulation, also known to be very effective.
And we're offering that here at Nystrom, right?
We are, and more and more so.
Very, very cool. I think hopefully there's been some helpful takeaways from today's episode. We really hope that it can empower you to apply some of these tips and hopefully become the best version of yourself.
So there are many myths about depression. One of the ones I really appreciate is they've shown people who've had depression, shown people who've died by suicide, and you see them laughing, you'll see these smiling pictures, and the point is, this is what depression can look like. And so people wear masks a lot to hide it.
Yes.
And so it's not just sadness. It's not like Eeyore from Winnie the Pooh walking around with a cloud over your head. It can be people looking very happy when in fact they're not.
I'm really glad you pointed that out because it can be hard for even trusted relatives and close friends to recognize when someone's experiencing depression because it can be so internal.
Absolutely.
I think another big myth is that it's somehow a sign of weakness or laziness. Depression, like we said, steals our motivation, steals our joy, and that can seem like, oh, I'm just not appreciating the good things in my life, and I'm ungrateful, and some of these words that are very harsh, right? That maybe I'm lazy, and it's like, well, depression can feel like a lot of those things, but it is absolutely not. It is something that's happening on a mental, physical, and spiritual level.
Absolutely. And I think medication is a great example of that too. People feel I'm weak, or, I'm not tough enough. And so we sort of think, oh, I just have to do better and try harder.
Yes.
And that there's really a criticalness behind that always presents or prevents us from being able to move forward.
Yes.
So medication is proven to be very effective in helping. In fact, it's hard. Therapy can be difficult sometimes without medication. So
Sure.
I have so much respect for people that get help.
I do
Takes
too.
courage to get the help, and doesn't take a whole lot of courage to keep avoiding it.
Exactly. So I think the big takeaway from this is you're not alone. There are so many people that are here to help. It's normal and okay to say, hey, I'm struggling, I need help. So reach out to a professional, reach out to a friend, and you're not alone.
Thank you for listening to this episode of Everyday Therapy. We hope you're inspired to apply today's insights to your own life. Don't forget to subscribe so you never miss an episode. If you found this podcast helpful, please leave us a review. It helps others discover the show and join our community. See you next session. Everyday Therapy is a production of Nystrom and Associates, one of the largest behavioral health organizations in the country. To learn more, visit nystromcounseling.com.